So you want to be an SLP?
What are you gonna watch? I don't know. I really don't feel like watching the news.
Good morning, New Jersey. I'm Catherine Driscoll reporting from Channel 6 ABC News. This week at Stockton University, Cohort 7 was chosen for the Masters of Science in Communication Disorders program. This program is designed to teach future SLPs. We have Adriana Formanowski reporting live on campus.
Hi everyone, I'm Adriana Formanowski, reporting live from Stockton University. They recently chose the new class for the Masters in Communication Disorders program, which is designed to teach SLPs. But what is an SLP? I'm here to find out. What is an SLP?
I do not know.
Student learning program? Service learning program.
I don't know.
A speech-language pathologist. Speech-language pathologist?
Speech-language pathologist.
A speech-language pathologist. I don't feel like watching the news. Give me the remote.
Not PBS.
An SLP, or a speech-language pathologist, may also be referred to as a speech therapist.
Can you please change the channel? The news was better than this.
What does an SLP do?
Basically someone who helps someone like learn a different language and just be adequate in it.
Work with people with speech disabilities.
From what I know about it, either helping like children or something get through like some sort of speech impediment type of thing.
Probably working with people as far as like that have speech impediments.
So they help people that have disabilities saying specific words and have difficulty with a lot of, can't really say because my cousin went through that. She went to a speech pathologist when she was younger and she had like a lisp and problems and she got it fixed.
They help people with their speech.
An SLP works with like stroke patients and people with speech disorders and impediments.
Overall objective of speech-language pathology services is to optimize individuals' ability to communicate and swallow, thereby improving quality of life. They work on prevention, assessment, diagnosis, and treatment.
What degree does an SLP need to practice?
I don't really not too sure.
I don't know.
Do I need a master's?
I say doctorate.
An SLP needs a master's degree.
In order to be an SLP, you need a master's degree, a state license according to location, and a certificate of clinical competencies.
Where do SLPs work?
Work?
Schools?
Yeah.
Hospitals?
SLPs can work in schools, rehab centers, hospitals.
SLPs work in early intervention, healthcare, including hospitals, home health agencies, skilled nursing facilities, ENT offices, outpatient clinics, and rehab centers. They also work in schools, including public, private, Catholic, and special education. They work in telepractice and private practice.
What population do they work with?
Older people?
Now, I'm sure you work with adults as well.
All. Everybody? Like children, elderly, adults, anybody that needs help.
SLPs work with every age, from birth to geriatrics, which is the elderly population.
What areas are covered by SLPs?
Basically, no, I can't. No.
I'm not sure. I should know that.
Areas covered by SLPs include language, speech, social communication, cognitive communication, swallowing, and elective services. Elective services include transgender voice and accent modification.
What does the word articulation mean?
I guess, yeah, being able to express yourself in a certain way.
In general terms, how you articulate an idea, it's how you present the idea, how you, that's it.
The way you pronounce a word.
To pronounce. Pronouncing things.
Yes, but I'm going to use articulate the same word, same sentence. but basically being able to fluently speak and pronunciate words and things like that.
What is fluency?
Able to convey your speech to someone.
Being able to speak throughout and fully.
What is cluttering?
Oh, I don't know.
Like making a mess?
Nope.
Something that's cluttered.
Yeah, like it's when there's too much in one space. Like,
Gosh, no.
Cluttering, like being messy or something like that, or
Definitely don't know.
Cluttering? Is it like when you have too much stuff, or? Yeah.
When you clutter a bunch of words together, I guess.
I guess multiple words like into one.
Speech is comprised of voice and resonance, articulation, and fluency. Voice and resonance is the pitch, intensity, quality, and resonance. Articulation is the production of speech sounds. This is what you typically imagine an SLP does, helping fix a child's mispronounced R or S sounds. Fluency is the flow of speech sounds. The following are both fluency disorders, stuttering and cluttering. Stuttering is the disruption of fluent production of speech sounds, leading to disfluent speech. These disruptions do not occur in everyone's speech. Cluttering, on the other hand, is rapid speech that leads to stuttering-like sounds that are typical to everyone's speech.
Language is both oral and written. Oral means talking and listening, and written means reading and writing. It's both receptive and expressive. Receptive language means understanding others, and expressive language means sharing with others their thoughts, feelings, and ideas. There's domains of language. There's pragmatics, which is the rules of social language. That's understanding the concept of turn-taking in conversation, how someone initiates conversation, and the overall communication with others socially. Semantics, which is the meaning of words and combination of words. Syntax, which is the use of word order to create sentences within a language. Morphology, which designates the rules in which the smallest unit of language can be used. And phonology, which are the rules of combining sounds to create words in a language. Social communication is when a person uses verbal and nonverbal communication in conversation. Disorders in this area may include difficulty communicating for social purposes, inappropriate use of talking according to situation, and difficulty following rules for conversation and storytelling.
Cognitive communication is the organization of thoughts, appropriate attention to task, memory, planning, and problem solving.
When it comes to swallowing, both feeding and swallowing difficulties are covered by SLPs. These difficulties may occur post-surgery, stroke, illness, and injury.
Who can do hearing screenings besides a doctor, audiologist, and nurse?
No one.
An SLP?
Yes, SLPs do hearing screenings.
What is aphasia?
Skin condition.
Evasion?
Aphasia is a speech disorder where you have trouble processing. I think you know what you're trying to say, but you can't get it out.
Like when a patient has a stroke and their speech gets messed up because of the stroke.
What is dysphagia?
Where I think it's where your speech is all kinds of you can't put it in the right order. I used to. I don't know anymore.
I'm honestly not sure.
I'm learning about it actually in my communication disorders class. We haven't got over it yet.
What does TBI stand for?
What is it about her? She just looks so familiar.
Nah, I don't really see it.
Common words and abbreviations to the field of speech-language pathology that are not common to everyone else include aphasia, dysphagia, and TBI. Aphasia, which is a communication disorder resulting from damage to the part of the brain that controls language. It results in difficulties in speaking, reading, writing, and listening. Dysphagia, which is swallowing problems involving the oral cavity, pharynx, esophagus, and gastroesophageal junction. And TBI, or traumatic brain injury, which is caused by sudden damage due to head impact. It results in physical problems, cognitive deficits, sensory deficits, communication deficits, behavioral changes, and swallowing.
I can't watch this anymore.
Okay, so turn on something else.
Ooh, what's the Stockton channel?
I don't know. Do you like to talk?
Do you like to eat?
I like that.
Are you a caring person?
That does sound cool.
Do you like wearing white coats?
Yeah, I like white coats.
This is why you should go to school to be an SLP.
Yeah, we should.
Starring by appearance, Adriana Formanowski as Adriana and Kat Driscoll as Kat.
This PSA was created, written, and directed by Kat Driscoll and Adriana Formanowski. Shout out to the stand-in directors Rebecca DeFrance and Danielle Smith for filming when both actors were needed on set. Special thanks to everyone we bribed with chocolate to participate in our interviews.
This public service announcement is dedicated to the hard work of Stockton University's MSCD program Cohort 6, the lovely Dr. Stacy Castle, and the entire MSCD faculty.
This PSA was created with the following references: